All of us, cope with our problems differently. Some of us can deal with them great. Some of us, we have other issues and other ways of coping with it. Because I was going through problems and I had started talking to a friend, and from there it led on to the drugs. When I found out I was pregnant, I was already addicted. I was already an addict. I was scared. I was really scared. What's gonna happen if you come and ask for help and, you say, hey, I have a problem, I'm a heroin addict. My worry it wasn't myself. My worry was my kids. Because right away, the first thing that pops in your head is CPS. I didn't know who to ask for help, who to turn to. I had first asked my family. So, I was hoping that they would help me out the first time. They actually all stopped talking to me because of the whole issue.
The amount of stress that these mommies must be under every single day. When a mom comes in and they are with substance abuse, there's a stigma, there's a prejudice, there's a bias, and it's very, very real to them. I think they don't feel empowered. I think they feel embarrassed that they have this problem.
Many of the women that I interviewed who were substance users came from very poor backgrounds, the issues of mental health that were not addressed. A lot of the women that I spoke with also had a history of violence in their past.
I started using when I was 12 years old. My mom was an alcoholic. My father walked out on her when I was like 2 weeks old. Her boyfriends molested me and did things with me, and so I just turned to drugs. When I was about 30, I started doing methadone, but then I'd always relapse and go back to heroin. And I guess it was just because I really wasn't ready to quit. I wanted to die. I was like, oh no, I can't be pregnant. I can't be pregnant. No, I'm 38 years old. I can't be pregnant. With losing 3 other children to the Child Protective Services, they wanted to take Sadie's as well. I just was to the point that I was tired of being tired of being tired of being tired of being tired. I went and I talked to Miss B, and she's like, Dawn, maybe this is, you're enlightening.
What we try and focus with the mom is helping them understand that if she is doing everything that she needs to do to move forward in her recovery, then she's okay. She's going to be okay.
When I was 15 years old, I tried heroin for the first time because it was just on weekends. I said, oh no, I just go and party. I'm not hooked, I don't do anything. And then I started selling drugs, and I had it all the time, so my addiction grew. I got pregnant at 16, and I didn't know what to do. When I was pregnant with her, I stopped using. After I had my daughter, about 5 months later, I started using again. When I found out I was pregnant with my son, I didn't want to get it to the doctor, because their attitude, not everybody, but those few doctors give all the doctors a bad look.
With the medical community, with the legal community, there is so much judgment and personal bias placed on women that use substances that are battling addiction. Specifically in the Latino community here in San Antonio, it is a huge issue. There is a significant amount of judgment.
Oh, okay, that one. Doctors and some people that don't have a lot of knowledge with the methadone, they look down on heroin addicts, and I'm telling them, I may be an addict, but I'm still a person. I'm still a human being. I had an experience, though, with one of the nurses, and it really bothered me because she called my son a drug baby. And I got mad, and I said, he's not a drug baby. His name is Alexander, because I feel like when there's kids that are sick out there that got the flu, they got pneumonia, they got a stomach virus, they're not labeled the pneumonia baby, the flu baby. He's a baby that's sick. He needs extra help, but he's a baby named Alexander. He's not no drug baby. I didn't know that there was this type of clinic. I always hear negative feedback about methadone, so I said, oh, I ain't gonna get on that. Because I said, I'll just detox. No, you can't. The baby can die. And I didn't know. I said, no, I can do it. I can do it. And I've been through a lot. I couldn't do that. But it wasn't about me anymore. It was about him.
Women that are pregnant cannot just stop using heroin or prescription narcotics. That's not safe, because what can happen is they can go into premature labor. The baby is at risk. They are at risk. So what is considered best practice for them is to go on a medication-assisted treatment such as methadone. Those medications help that patient feel normal. It takes away the withdrawals, the cravings. You should not be able to tell that they are on a medication.
To fully understand the complexity of the issue, you have to understand the full spectrum. So it begins, early on for many of the women. They're very young, typically when they first are introduced to drugs. The women that I talked to were all introduced to drugs by a very trusted person, and they were really kind of naive when it started. And, I don't think that at the time when they were 13 or 14 and it was starting, they were looking down the road to, oh my goodness, someday I might have a baby that's exposed to opioids.
Oh, baby, I love you so much, honey. I would cry a lot because I felt like I did that to him. Any mother would be scared for their child to go through the withdrawals because we don't like going through the withdrawals. It hurts us. Imagine how it hurts a newborn.
Neonatal abstinence syndrome occurs when an infant has been exposed to, primarily it's opioids, because it crosses the placenta and the baby's exposed to it while they're in the mom's uterus. Once the baby is born, then the baby goes through withdrawal much like an adult would go through. Being there as often as they can be, learning different ways to comfort their infant and be a part of their infant's life is really, really critical. We already have a situation where moms and babies are separated because of the infants, experiencing neonatal abstinence syndrome. What you really want to have happen is a good, strong attachment between mom and baby, and that can really affect the mother-infant relationship for years to come after that.
I went and saw her every day. I would just rock her, sing to her, pat her back, give her warm baths. She's a really good baby, though. As long as she was happy, I was happy.
With my son, I want to hug him, I want to kiss him, I want to cuddle with him. And at times he doesn't like that. No matter what I tried to do, he wouldn't calm down until I would swaddle him up and lay him aside, give him his pacifier. Once he was out of my arms, in his swing, he would calm down.
The most important part is making them powerful with information. So when they come to the NICU, they're fully prepared for what they might see, but they're also fully prepared to ask questions if something is different.
We didn't actually go home until she was like 9 months old. So we were in school, we were in class together all the time. So many classes. I learned a lot in there. I learned coping skills, I learned parenting skills, I learned relapse prevention. I mean, there was NA groups, there was AA groups. They have all of those resources. That's where I found it at, was through them.
There's a lot of classes, the 13 classes that they need to go through, from childbirth to nutrition, to what it's going to be like when their baby withdraws. We have all kinds of experts from our hospital that comes and talks to them about what they need to know, how they need to prepare, and what they can expect. The work belongs to them. The hard work does belong to them, but we need to provide them the resources to help them succeed, and I think that's what this program does.
I've never came across a place that has so much to offer. It got me out of the guilt stage, just knowing that, yeah, he was there and he was sick, but that he was gonna get better and that one day he'll be out of there, So that's what helped me to get by and just stay strong. Once I accepted where I was in my life, I was able to move to the next step.
It's a very complex issue, substance use is, and it really takes kind of a multi-disciplinary approach to manage it.
Addiction is a very, very difficult disease to deal with. And really, it's having them understand that so that they can get those skills that they need to be able to deal with those difficult moments that prompt them to want to go back to that substance.
Don't put the baby through it. It's not the baby's fault. There's programs out there, there's help out there. You just have to want it. Miss B is like, Dawn, just do what you're doing and they won't take her. You know, just stay strong, stay in the program, learn your coping skills and everything will be okay. And I said, all right, and it worked. And it's still working for me today.
Don't be afraid to seek out that help. It's going to be a tough road. It's going to be a lot of work, but it's possible. People do it every day and are able to become successful, productive members of society. But more than anything else, for those that are parents, you know, so that you can be there for your children.
I almost cried when I left the hospital. You grow feelings for the nurses there. They were with me through the whole journey. I love what they do in life. You know, working with babies like that, that's what I want to do now. I can relate to those mothers that are going through what I went through. So that's what I'm going to start doing now, is going back to school for that, to be a nurse like them.
Life is great. I have a job. We have a place to live. We got our own transportation. And I never thought I would have all that, you know, to say that, well, we achieved it. On.
When I started, I had a prejudice and a pretty strong bias about these mommies, and I don't see it that way anymore. I see that these are women who are struggling with a problem, substance abuse, and they're pregnant and they need help.
We've had so many cases where mom is doing what she needs to do, and eventually the case is closed.
One mom that I talked to said she never ever misses a NICU reunion. They go back every single year to visit that one particular nurse that was so meaningful to them.
I don't know what I would have done without it. I probably wouldn't have Sadie's. She's a good kid. I love her to death. I have a full-time job. I'm training to be a manager of my place where I'm working. It's actually pretty weird to have a normal life, but it's a good normal life, you know? Where being abstinence, I mean, I never thought that I could do it, but I did.
He's healthy, you know, he's awesome, he's great, you know, he has us running behind him now, you know, so I just, you know, that there is hope. The knowledge that I've gained and that I've learned, it made me realize that it saved my life. You know, I always thought, well, there's nowhere I can go, you know, and now I found a place that I can come to where I belong.
Can I see you talk to the monkeys now? You know, I knew one way or another I was, you know, things were gonna get better and I was gonna be able to bring him home, but I just really didn't know where to start. If I would have known then what I know now, I would have came a lot sooner.